This morning, First Lady Melania Trump underwent an embolization procedure to treat a benign kidney condition. The procedure was successful and there were no complications. Mrs. Trump is at Walter Reed National Military Medical Center and will likely remain there for the duration of the week. The First Lady looks forward to a full recovery so she can continue her work on behalf of children everywhere. So that is the full statement from her office, from the press office of the First Lady. Again, this is just breaking today. This is something that happened this morning when she went in. Again, it seems that the surgery went well. It was a kidney surgery for a condition that is considered to be benign. And she's resting comfortably.
Okay, let's. I'm going to have you stand by for just a second, Kate, while you talk to your sources. This comes as a surprise to us. I'm going to bring in Dr. Sanjay Gupta. So this statement that Kate Bennett just read for us, Sanjay, an embolization procedure to treat a benign kidney condition. What does that tell you?
Well, typically, when you think about an embolization procedure, it's to try and stop blood flow to a certain part of the body, a certain part of an organ. In this case, it sounds like the kidney. Sometimes if you're worried about something bleeding, typically it's done for cancer, although it's very clear in this statement that this was a benign condition. That's how they've framed it. So it doesn't sound like it's a type of cancer. Sometimes things like fibroids or cysts or something like that can be something treated as well. Now, an embolization procedure typically is done less invasively. It doesn't involve an incision necessarily on or around the kidney. So it's a little bit unclear exactly what she had done. If you think about a benign kidney procedure, typically if she's late 40s, 48 years old, I think 47, doesn't have a history of anything like this, you typically think about kidney cysts, a cyst that could develop on the kidney and start to actually interfere with how the kidney functions. And that could require surgery. Not very often, not very common at all for that to be done, but if it does get to a certain size or causing certain problems, that could be what the operation is necessary for as well. So probably need a few more details. We also heard that she's going to be in the hospital for a few days now. So, they're expecting a recovery period that's not insignificant. This obviously is not an outpatient procedure. That also gives you some idea of how significant this procedure likely was, more significant as opposed to something that's just very simple where someone goes home the same day.
So explain that again, the embolization, you're saying that's actually that you want to stop blood flow to an area for a reason? Yeah, right. Typically, if you're worried about a particular area of the body or a particular part of an organ having some bleeding, or you want to stop blood flow to that area, you can essentially embolize the blood vessels that go to that area. You can try and block the blood vessels that go to that area using some kind of glue or something like that because you just don't want that area to bleed. Or you're worried about it bleeding in the future. So typically you think about this, for example, with uterine fibroids. That's a more common sort of thing. If there was something of concern that they saw on the First Lady's scans, something that they thought, we don't think this is cancer, but we worry that it could bleed or cause some problems later on down the road, you could do an embolization procedure. Maybe they did this embolization procedure and something else. I'm just reading the same statement that you are here. Just says she underwent an embolization procedure to treat a benign kidney condition. That's all we know right now. So if you said you really would need more information to know what's going on. So what would the questions be that you would need answered, aside from was there something else done in addition to this embolization procedure? Yeah, I think the big question is what specifically was being embolized. We know that it was something to do with the kidney. Was it a mass, a growth on the kidney? Was it something that was more like a fibroid? Again, when I hear benign kidney condition, most of the time you're thinking a cyst. And a cyst is basically a fluid-filled structure that can sometimes develop on top of the kidney or even within the kidney. It's not something that typically gets embolized. So was there a cyst and something else associated with that cyst? What is it, I guess, is the question that I would want to get answered. What exactly was embolized and what was the thinking behind it? Because the thing to you that makes you wonder, Sanjay, and you tell me if I don't have this right, but from what you said is when you're talking about recovering for the rest of the week in the hospital, that is a prolonged recovery period for something that you would think of, for instance, being usually a benign kidney cyst.
That's right. Again, most kidney cysts don't even require surgery. The vast majority of them do not require surgery. So if it was a big enough cyst or a cyst that was somehow causing some sort of problem, like blocking the normal functioning of the kidney, you may understand how that would need surgery. But typically, that's a laparoscopic type operation. It's done fairly quickly. And while somebody may be in the hospital overnight, sometimes they can even go home the same day, but if they're in the hospital overnight, we're not talking about several days in the hospital, which is what we're hearing here. So what exactly was done? Why was the embolization necessary? And what is it that the doctors think should keep her in the hospital for several days? Again, that's a clue that we should be looking into.
All right, Sanjay, stay with me because we do have this breaking news that Melania Trump has undergone a kidney procedure at Walter Reed Medical Center north of Washington, D.C. in Maryland. This was a benign kidney condition, according to the White House, but there's still a lot of unanswered questions, as you just heard Sanjay explaining some of them there. I want to bring in Dana Bash to talk about this. Either way, this is a big deal, to have the First Lady who's going to be recovering all week in the hospital, a lot of unanswered questions. And typically, we don't always you get a lot of health information about the president. You don't always know that. You certainly don't always know the family history of the First Lady, but this is something that, this would be very concerning if it happened to anybody.
Absolutely. First, let's just all say, clearly, we wish her well and hope that she has an easy and speedy recovery. What Sanjay was talking about, and obviously he's the doctor here, but the point that he made just as a layman, what I saw, and I'm sure you did as well, the fact that they're saying it's benign and maybe trying to downplay it, but at the same time saying that she had surgery and she has to stay in the hospital for several days. Now, she's the First Lady of the United States. She's at Walter Reed. It could just be a precaution that they're keeping her there. But at the end of the day, we don't know when they say benign kidney condition what exactly that means. But I agree with you. The fact that they are disclosing this, it should be something that we expect, and we do expect of our leaders. It doesn't always happen in this White House, so we're glad that we saw it. We got it officially from the White House and not having to dig it up reporting-wise.
That's right. I want to bring in Kate Anderson-Brower. She wrote the book on First Ladies. It's called First Women, and she certainly follows Melania Trump's every move. Kate, this is surprising to anyone who has had their eyes on Melania Trump. Just here in the last week, she has been very busy. She unveiled her agenda more than a year into her husband's presidency. This is a woman with a lot on her plate, and now she's dealing with a medical issue, having had kidney surgery.
Oh, she certainly does have a lot on her plate, and I was really impressed that they came out and released this. It does remind me, completely different circumstance, obviously, but Betty Ford had a mastectomy when she was in the White House, and she came out and was insistent that it be described exactly as it was, not just the women's problem. So at the time, that was very revolutionary. I think that everyone wants to give First Ladies privacy. Medical conditions are obviously very personal, but I think it's a good sign that they came out and at least explained what was happening with her, and of course, we all wish her well.
And so just tell us a little bit about recently where we have seen her and what she has been up to those who have not been paying attention.
Sure. Well, last week she unveiled her campaign, the Be Best campaign, about, stopping cyberbullying, and, it was a broad campaign about children. We really have seen her shine when she is dealing with children, interacting with them. And I think that, she has begun to kind of come into the role of First Lady. It's taken her a little longer than most, but she's really come into embracing it. We saw her approval ratings last week. I think they were about 57% in the recent CNN poll, which is higher than her husband's. So she's a real asset to this administration. And I think it's pretty incredible that she, has been out there so much so much dealing with what was obviously a medical issue at the same time, and that speaks very well of her. But she's really been a very traditional first lady, and I think in many ways that's helped keep her approval ratings really soar in recent weeks.
What about, according to Kate's reporting, and keeping in mind, obviously this is something that was done and we didn't learn until after the fact, so we're still waiting to see exactly. But in terms of the president's movements, it appears that he is still at the White House, right?
Yes, I mean, I have not heard otherwise. I think that, and that would be typical. I think that, it would make sense for him to visit at some point tonight privately. But I mean, even when something like this happened to Betty Ford, it was something that was done very privately and not announced when he visited. So I'm not sure when that's going to happen, but I would expect him to go to Walter Reed soon.